Welcome back, my people. I always enjoy and feel happy when I'm educating people and people are reciprocating by appreciating or giving positive feedbacks. That means our videos and our education is touching somebody somewhere. So, my sister, my brother, my mother, my relative, why should you be left behind? This is very important. It's so hard to get somebody giving you a free education just like that. So let's subscribe, like, comment, and share our videos so that they may reach as many people as possible. Let's make this channel grow bigger so that we may benefit more as time goes on. Thank you for the subscription for those who have subscribed and those who are liking and those who are enjoying my content. Let's get back to our point of discussion whereby we were discussing about the viruses that cause viral gastroenteritis, and more specifically we are on rotavirus. I think this will be just a repetition and I won't take much time in rotavirus because we have discussed it like 3 days ago in broad. So if you go to my channel, you will see rotavirus in depth. So rotavirus affects young children and infants. Mostly it affects children and young infants. It's usually contracted via mouth and symptoms appear within 2 days of infection and include the following. Symptoms appear within 2 days of infection and include the following. Number 1, vomiting, as we talked about, loss of appetite, watery diarrhea lasting between 3 to 8 days, and the child might also have fever and dehydration. So, early vaccine against rotavirus is recommended to prevent severe rotavirus illness in infants and small children because, as we said, the rotavirus vaccine can be given between 2 to 6 months. We have the one that can be given 2 months and 4 months, and we have the 3-dose one which is given 2 months, 4 months, and 6 months. So over 6 months you can give rotavirus injection. And if you are within Mombasa and you want your child to be injected, just contact me and I'll offer that service. So many people fear thinking it's an injection. No, rotavirus vaccine is always given on oral route or through the mouth. So don't fear thinking that it's an injection. So let's discuss about an adenovirus. I said I won't take much time discussing about rotavirus because we have discussed it above 4 days ago. So it's in my channel already. Adenovirus. Adenovirus affects all ages and causes several infections, including gastroenteritis. So among the diseases that adenovirus cause, we find gastroenteritis there, and more specifically viral gastroenteritis. It can also cause common cold. Other diseases that can be caused by adenovirus are common cold, like symptoms, bronchitis, pneumonia, and pink eye, which can also be called conjunctivitis. Children in daycare, especially under 2 years of age, are most likely to get adenovirus. Below 2 years and in daycare, because of the groupings and being at the same time, so many children at the same time, those groups, or as we said, the gatherings, can you predispose one to get, or your child to getting this kind of an infection. So children in daycare, especially under 2 years of age, are most likely to get adenovirus, which is passed through air, the meaning is airborne, via sneezing and coughing, by touching contaminated objects or touching hands of someone with the virus. Let me repeat this because it's very important. How this adenovirus can be spread. Children in daycare, especially under 2 years of age, are most likely to get adenovirus, which is passed through air via sneezing and coughing by touching contaminated objects or touching hands of someone with the virus. Symptoms associated with adenovirus include the following. We have talked about how it can be spread. So let's see how will somebody having adenovirus present. Number 1, sore throat. Number 2, pink eye or conjunctivitis. Number 3, fever. Number 4, coughing. Number 5, running nose. Most children will feel better within a few days of experiencing adenovirus symptoms, especially when your immune system is strong. I hope you get everything there. Let's discuss about the other virus, which is Astrovirus. Astrovirus. It commonly causes gastroenteritis in children. What are the symptoms? How will a child having astrovirus present? Number 1, stomach pain. Number 2, diarrhea. Number 3, headache. And we have what we call mild dehydration because of the vomiting, because of the diarrhea. Obviously, due to the diarrhea, the child will lose a lot of fluids. That's why we said in food poisoning, you must keep the patient hydrated. We have a point to note here, a very important point. This virus mostly affects people in late winter and early spring, and it's transmitted through contact with a person who has the virus via infected surface or food. Obviously, the food must be contaminated. Let me repeat this point. This virus mostly affects people in late winter and early spring and is transmitted through contact with a person who has the virus via infected surface or contaminated food or water. I hope you are getting this. What are the symptoms? After how long will the symptoms we have just talked about, the diarrhea, the headache, the mouth dehydration, and the stomach pain, after how long will these symptoms show? So, symptoms appear within 2 to 3 days after initial exposure. If you are exposed to this virus, the symptoms will present after 2 to 3 days. Symptoms appear within 2 to 3 days. Symptoms appear within 2 to 3 days after initial exposure to the virus, but will usually go away within 1 to 4 days. They appear within 2 to 3 days after exposure and go away after 1 to 4 days. So, this marks the end of our discussion today, and in our next topic we'll be discussing about complications of viral gastroenteritis. Guys, let's continue keeping the support on. Let's continue subscribing, sharing, and commenting on our videos. Let's meet in the next video. Have a good evening.